So, good afternoon or whatever time it is when you guys watch this hopefully very interesting session on stress and anxiety. So first of all, I think just a very quick introduction about me. I'm Tiffany. I'm the Chief Operating Officer here at Naluri, and I'm so honored to have with me here Sean and also Farah, who are both clinical psychologists, and I am so excited to hear more about this, I guess, very common words that we hear in our day-to-day, especially since MCO started last year, stress and anxiety. But I'm sure there is a lot more underneath those two words that may seem common. So maybe kind of before I jump into some of the technical aspects and not so technical aspects of stress and anxiety, maybe Sean, if you could just quickly introduce yourself. And I also want to take this opportunity to just hear a little bit more about your experience dealing with people who have stress and or anxiety.
Hi, everyone. My name is Sean. I'm a clinical psychologist currently affiliated to Hospital Selayang. And the majority of my clinical work is revolving around helping patients with chronic pain get back on their feet. So chronic pain basically is the type of pain condition that will never go away. So if you have ever experienced pain before, you will know that having pain will actually make your mind more confused. It will make your physical activity more effortful, and it will generally make life more difficult. So stress is automatically a given in patients with chronic pain. So obviously, in order to help patients with chronic pain function better, we also have to help them manage stress.
Thanks a lot for that, Sean. I never thought about it that way. Whenever I'm in pain, I'm just like, what can I do to make the pain go away? But I think you're right. Like that whole emotion of wanting to make the pain go away in itself is stressful. So already learned something 2 minutes in. How about you, Farah? Tell us more about yourself and also maybe a little bit more around your experience in dealing with people with stress and or anxiety.
All right. Hi, everyone. I'm Farah. Currently, I'm a clinical psychologist in Naluri, and I also volunteered in some NGOs, especially providing intervention for the population of domestic violence and abuse victims. So my work mostly involved being a part of like providing intervention to the community. So I am well versed in community mental health and working with the survivors of domestic violence and also abuse. There's actually a lot of stresses going on, especially in terms of safety and also the traumatic experience that they have gone through. So I guess when it comes to stress and anxiety, it's actually part of our life. But when we gone through something traumatic or something very stressful through our experience, then that's the thing that me as a clinical psychologist, I come in and help them provide the right intervention.
Thanks a lot for that, Farah. So great to hear that we have such a diverse kind of expertise in terms of both your experiences in the hospital population and also in the community population. And I kind of look forward to hearing even more about those specific experiences. But before we get into that, just on kind of technical aspects, I would love to just hear from both of you kind of your definition of stress and anxiety, and why are they often looked at together?
So most people have difficulty differentiating between stress and anxiety because they manifest exactly the same physically and in terms of experience. When we feel stress, the experience of it is exactly the same as anxiety. This is because it is manifested from the same system in our body. So we call that the sympathetic nervous system. So this is also the system that would be activated when we are feeling excited, when we are feeling threatened, and so on. So a lot of people have difficulty differentiating between these two because they feel the same. Technically, we differentiate these two things based on the contributing factors and how we get these experiences. So generally speaking, we would consider something as stressful if the effect is immediate, if it is contributed by something that is immediate. So for example, if I am given a task that I don't feel I'm up for it, I will feel very stressful because I feel I can't fulfill my job well. So that's immediate. But once the job is done, I should feel better. For anxiety, it is more of anticipatory kind of process where I'm worried about the future. it may not necessarily be something that is immediate or current. So generally speaking, in terms of body sensation feelings, they are pretty much the same. It is really how we get that feeling and the way we think about it that differentiates between stress and anxiety.
That's a very helpful way to think about it, because I think, Sean, you're right? Sometimes when I'm feeling stressed and I'm feeling anxious, right, like what I get is then I get a sense of feeling jittery, and I can't even list all of them out. And maybe Farah, you can help me, right? Like, what are some of the common physical symptoms that someone who may be experiencing either stress or anxiety may exhibit?
Thank you for that, Tiffany. So I think when it comes to stress and anxiety, like I second what Sean said, it shows the same similar responses. But one thing that I would like to highlight here is stress and anxiety is just part of our life. It is a matter of how can you handle it. So I think when it comes to stress, what I want to highlight here is like the physical responses towards something threatening that we perceive as threatening. So, for example, like you are given a task to go on stage and give a speech, you notice that you maybe start to sweat and those kind of things. So that's actually how our brain processes that this is something, we perceive it as something threatening, but it's actually not. It's just like you going up to the crowd because it's something that you're not familiar with. So you start sweating, or maybe you like to think on the worst possible things that may happen when you go on stage. Maybe you freak out, maybe you say something wrong. So aside from that, if we focus on the body sensation or the physiological sensation, sometimes you do experience trembling of hands, or you may experience difficulty in breathing. You notice your breathing started to like rapid or fast. And some people also, they experience like indigestion, headache. So it depends on how your stress response is. But again, it's a normal response if we are going through something pressuring or difficult. But when stress becomes chronic, that's when it started to disrupt with your daily functioning. And when talk about anxiety as well, like how to differentiate, how I would share is that there's also the worry part. Like anxiety is like the interaction between worry and also stress. So the worry is the thought component of anxiety, while stress is actually the body sensation for anxiety.
Thanks for that. So I think if I sum up the way that both of you have differentiated stress and anxiety, stress is really more like, while they share common physiological symptoms, the difference really comes when stress is something that is more, you're responding to an external situation that has happened, but it lacks this element of worry because it's more about what do you do in this current time, whereas anxiety has a little bit more of the future aspect to it, where you're thinking about what could happen in the future. So thank you for that. I think, Sean, I wanted to circle back to something that you mentioned. And I think what came to mind when you were explaining the difference between stress and anxiety, I think you talked a bit about the way that we label those physical or physiological symptoms. And it made me kind of think of, well, then are you saying that we require some level of emotional maturity in order to put the right kind of label? I think question number one. And I think question number two is then, how important is it that for a layperson, non-psychologist, how important is it for us to know what the right label is to put on our physiological experiences?
The way that I will be answering this question can be a bit technical, but I'll try to explain it in a way that most people can understand. So it is extremely important for us to find the right label for our emotion. So just think about this. Imagine yourself on a roller coaster. What would you experience, right? You will probably experience palpitation. Okay, you will probably be sweating. You'll probably be screaming. Your pupils will probably be fully dilated. So all these physiological changes are exactly the same as stress and anxiety. But when you're on a roller coaster, would you describe it as a pleasant or unpleasant experience? Most probably pleasant. You most probably enjoy the process. But at the same time, we can actually label the experience of on a roller coaster as being stressful and anxious as well, which is also true. So when it comes to understanding emotion, there is a part of our physiological experience of it, and there is also a part of our brain, our understanding of why we are feeling this. So finding the right label will help us understand whether this emotion is a pleasant one or an unpleasant one.
Thanks a lot for that. So I think if I kind of sum it up in a way that is, I think, most layperson friendly, it's really about kind of not reacting as quickly to physiological symptoms that we may experience, but also just kind of taking maybe 2 steps back if necessary to then evaluate the situation that we're in, then to put the right label on it. Okay, got that. So maybe then on to you, Farah, because I know you talked about how, stress and anxiety is normal, right? And I think from what we've learned from Sean as well, that being able to, because it's a normal situation, and because some of these physiological symptoms also happen in positive situations, then you need to put the right label. But then besides that, how else do we know when stress and anxiety become something that we need either professional help, or we need to actually go a step further than just evaluating our current situation to then think about whether or not it is something that needs further attention?
To answer your question, I think we can see this in terms of the signs of stress or anxiety. And I would like to put it in a way that you notice the changes in terms of your emotions, your behavior, and also in terms of your body change. Right. So when it comes to emotion changes, so we can see whenever we're going through something stressful or something quite overwhelming, how do we usually respond to that? Like when we're in a state that we're emotionally stable, maybe or more rational in terms of reacting to something. But when we are quite in that distress mode, we can be easily irritated, or we experience intense fear, anger, frustration. And there can also be some kind of work-related stress as well, where we're when we're doing work, we're not really focused in doing it. So that's on the emotion part. In terms of behavioral part, it could be we are more withdrawn into socializing with people, or we become inflexible, indecisive in doing or making decisions. Maybe in terms of sleep as well, we may not be sleeping properly. We resort to unhealthy coping skills like excessive smoking and drink excessive alcohol and being aggressive towards something, or we become very fearful in doing some things. And in terms of bodily change as well, I think we discussed previously, we do experience frequent headache if you're having migraines, nauseous, or indigestion. May not be because of food poisoning or anything, but you just experience this indigestion. It could be something we can call as signs as well. And one important thing to note is that when all of these symptoms, it disrupt with our daily functioning, we cannot work well, we cannot do our daily activities well. So that's when it's a sign that perhaps you need to go for professional help to see whether perhaps you have the symptoms, or it could be just a one-off thing, you experience something, it's just a one-off symptoms, and you'll be better in a few days to get them. So it's important to look into getting the right help.
Thanks a lot for that, Farah. So I think you put it in a way that in my mind, if I tried to think about it in a chronological manner, right? So first we start with physiological symptoms, right? But then some of the signs that you talked about, Farah, involves kind of when emotion gets in play, right? Where you get kind of more complex feelings like worry and anger and all those things muddled up together with your physiological symptom. And then it escalates further when you then also show behaviors that may be maladaptive. So is that really kind of the right way to think about it, where it's almost sequential? Or have you guys in your experience seen people who could just suddenly be triggered by a particular event and they go from normal to needing urgent attention? Maybe Sean, in your experience working in the hospital population, or maybe even people with chronic pain, have you seen those instances?
Definitely, we have seen people who can develop stress and anxiety reaction very rapidly. Generally speaking, the way that we would understand it is that once you have developed certain way of responding to stress and anxiety, you tend to get to that level very soon. So this is to say that initially you may have a very slow engine. You will develop symptoms like this in a very gradual manner. But as time goes by, you notice that you become more and more rapid in terms of the building up of the symptoms and reaction. So initially, it may take you this level of stress in order for you to generate this level of symptom. But over time, it can become like you are experiencing this level of stress, but you are experiencing this level of symptom. So we change, generally speaking. Another thing important to note is that one of the indicators for you to seek help is probably when you hear a friend of yours or someone who is genuinely concerned about you asking you or encouraging you to seek help. Because most of the time, we ourselves are not very good at evaluating our own symptoms because we think that, oh, I still have capacity. I still think that I'm not that bad yet. But usually people around us, people who are genuinely concerned about us, they could tell. So of course, I'm not saying that, I'm not referring to people who are asking you to seek help because they're trying to insult you in some way, because people do that sometimes. But if your loved ones, people who are really concerned about you, are encouraging you to seek help, that's actually a good sign.
Yeah, so I think two images one image and kind of one word came to mind when you were sharing that. I think one is, like, I was just thinking about a rubber band, and then how, like, if it's constantly stretched, right, like sometimes the slightest amount of pressure would just break it. And I think the second thing that came to mind was then this whole idea of perception, right? Because sometimes then it's the amount of stress that you may be facing might be less than what you had before, but then for whatever reason, this particular instance really triggered you. So then just on that, Sean, maybe you could elaborate further on, like, what can we do to ensure that we are not in this constant state where this rubber band is about to break? Or what can we do in just kind of helping us manage our perception of the potentially stressful situation that we would inevitably find ourselves, especially at an unprecedented time like this?
Now, the fortunate thing is that we human beings and our human minds are not like rubber band. Rubber band is a material. So over time, as time goes by with wear and tear, it will become weaker. And at one point, it will break. We human beings, just like our muscles, we can rebuild, we can reconstruct ourselves. So even if we have endured a long duration of stress and we are now loosened, there is a way for us to rebuild ourselves, and then we'll become stronger and we'll be able to withstand more stress over time. So the main thing here is to allow yourself to recover, to allow yourself to learn how to overcome stress and manage stress so that you become a stronger rubber band. So we are the type of rubber band that can regenerate and we can become stronger and grow. Unlike a real rubber band where over time it will eventually break, no matter how well you protect it.
It's a very hopeful message. So now I'm going to start thinking of myself as a regenerative rubber band. So I think, Farah, in your experience kind of working in a community setting and then working with people who have gone through, unfortunately, probably some very painful, traumatic experiences, what are some of the advice that you have given to help them become this regenerative rubber band, if I may kind of coin that term right now?
So usually what I would do in this kind of circumstances is first to empower them, like know that the experiences that they're going through, it's a normal reaction after you're going through something traumatic or something stressful. It's just a normal reaction. And secondly, to also like explore what are the things that can make them feel better. Because that sometimes we cannot change the circumstances that they are in, but we can change the way they think about themselves, the way we perceive the world. So empowerment is very, very important. And also another thing is to find the right resources that can help these people. Could be like social support. It could be even the basic needs that they need, because sometimes when their basic needs is not fulfilled, that's when they will start to think about all the possibilities that may affect them negatively. So empowering. And secondly is also to allow them to have the space to be vulnerable. I think that is very important, because before this, they don't have the chance to actually like feel or to actually accept it. So let them accept and be vulnerable. It's one way towards recovery. And from there, we start to do the necessary intervention for the symptoms that they show to us.
Thanks a lot for that, Farah. And I think, kind of thinking about, again, if you don't mind sharing in your experience working with this diverse pool from the community setting, right? Have you seen any predisposition for certain groups of people, either based on age or maybe based on gender, that you feel, when you're thinking about empowering someone, it has to be something that is very personal to them, right? So then in that, have you ever seen any kind of patterns of people who may be more vulnerable to kind of stress and anxiety?
Yeah, so I think with what we have discussed, there are some symptoms or some situation that we all share that somehow resonates to us. But there are also some circumstances where people, their distress tolerance is a bit lower as compared to other people, and they are more affected to stressful situation. So based on what I've seen before, sometimes those who are actually experiencing financial struggle, that's one thing as well, because they are in constant pressure. They need to provide, or they need to pay this, they need to do that. So I guess that financial struggle is one thing that I noticed. And another thing is also depending on their life circumstances as well, whether they're actually being pressured with so many things that are going through. It could be expectations from other people, or their life journey as well. It could be already difficult, so that's why they're in that constant state of stress and anxiousness. But again, it doesn't mean that even though they're in that spectrum of people who have higher risk of experiencing stress and anxiety, but again, I think the point of resiliency and also distress tolerance is very important, because there are people who are actually in that state where they actually tolerate better in this kind of circumstances. And there's nothing wrong with whichever spectrum you are. I mean, as a person, you have your own capacity and capability in terms of healing and also recovery. So I think we do take note on the risk factor that can provide or that can cause someone to be in that state. But again, there's also the protective factor that plays a role as well.
Thanks a lot for sharing that, Farah. And I think maybe I want to ask Sean, in your kind of opinion, I think whatever that Farah has shared, I understand it on an academic level, right? Like as a clinical or a practitioner, as the both of you are able to very quickly make assessment in terms of risk factors, in terms of a person's stress tolerance and all that, in a very quick conversation with someone. But for a lay person, say for example, for me, right? And I think as you mentioned, Sean, a very good mirror to how severe our situation is to trust those around us when they ask us to seek for help. But if I were to almost want to be a frontliner to support my family member who I see is in, kind of extreme distress, how do I do whatever that Farah has just mentioned in making those quick assessment on the extent of the help that I may immediately provide to a family member?
The kind of help that you can provide really depends on what the kind of help that you can provide. So as a family member, my view is always just to be a family member. So leave the professional help aspect to the professionals. So the main thing is to allow yourself to go through the experience with your loved ones. So this question is actually a very, very broad question. It involves a question on how do I identify whether someone that I love needs help. And also, if now I know that this person needs help, what kind of help can I give? The truth is, if someone is intentionally hiding his or her stress and negative emotions from you, there's no way you can tell, not even for a professional. It is not uncommon for professional mental health clinicians and even doctors to not pick up signs if the patient is consciously and intentionally hiding it. So there is really no way you can tell. To me, the best way we can be of help to other people is just to be open enough, to be the person that people will come to you when they need help. So it is more about being a good human being ourselves, being open enough and being compassionate enough so that people will come to you when they need to. So the most important thing is not to impose, not to tell people that you need help, not to tell people what's the right thing to do. Just be the compassionate person that people will naturally come to you when they need help. It's easier said than done. because it requires us to change the way we are.
Yeah, thanks for that, Sean. Are there some kind of recommendations? And I know again this might be a little bit broad, right? But are there some do's and don'ts or specific words that we really should not be saying when, on an intent level we are trying to be compassionate, but then what we then say sometimes doesn't quite, sync with our intent? So do you have any advice in terms of, what is a right phrase to approach someone with?
Well, the thing is, there is no right phrase because everyone is different. But there are some generally wrong phrases. Okay, so for example, you have to listen to me. This is generally a big no-no because when someone is experiencing emotional difficulties, they are generally defensive. So even if they know that they need help, you saying that you have to listen to me, I know what is wrong with you, I know how to help you, is going to create more defensiveness in the person.
There, number 2, number 3, because I'm really guilty of the first one. I want to try to get to a point that maybe I can say, but for the other 2, I'm not guilty of it. Mm-hmm. Noted. I shall write that down after this. Is there anything else that I should not be saying?
The truth is, the list goes on. And if I list down everything, in the end, no one would be helping anyone else. No one would be reaching out because if you don't understand the person well enough, everything can be a landmine. So rather than listing out all the don'ts, I will probably give a do here, a recommendation of what we can do. So for me, I think that being open about sharing about our own vulnerabilities and pain is a good way to go about it. People like to hear from other people who also have similar experiences. If you're always in a position that you are teaching other people, you're telling other people that you need to do this is the right way to do, but you never admit to your own mistakes and your own vulnerabilities, people are very unlikely to listen to you. If we look at these great leaders in life, right, they are not shy about sharing with us about their own personal mistakes and vulnerabilities. So one way to present and to also tell people that we are compassionate and we are really here for you is to also tell them that I've also gone through the same thing. And these methods helped me. I'm not saying that it will help you, but it helped me, and I believe that it will probably help you as well. It's not that you are insufficient. It's not that you are problematic and you needed help. It's just that I've been through a similar kind of situation and this helped me. I am trying to help myself and it did help me. So I hope that this will do the same for you. So that's the position that I would take.
And Sean, as you were saying that, I was almost confused if you were giving me an example or if you were actually talking to me. So I think that specific phrase, I actually also need to write down because I think it definitely works in just displaying and I think showing that you genuinely care for another person. So, someone that you love's well-being. So thanks a lot for that. Maybe I wanted to direct the next question to you, Farah. And I think going back to what you said earlier around how stress and anxiety is normal, right? And I realized that we have kind of painted stress and anxiety as being this thing that is, not so good, being this thing that needs to be dealt with. We need to look out for signs. We need to know how to help others. We need to know when to ask them to escalate for help. But are there situations when stress and anxiety could actually be a good thing?
Indeed. It can be a good thing. It goes back to our perspective on stress as well. There are good stress, there are bad stress. So good stress is when it drives you and motivates you to achieve something. For example, you're putting in position that, a simple position like you have to sit for an exam. Okay, so you have to score for the exam so that you can get good marks and this kind of thing, for example. So exam is a stressful thing. So it drives you to study. So when you study, so that hopefully you can answer the exam questions better. So it increases your productivity and it makes you move towards your valued goals. But when it's causing you to have all the symptoms that we talk about, it disrupts with your daily functioning and daily activities. That's when it's considered as a bad stress. The same thing for anxiety as well. If we go back to the sort of worry part, we need to be worried as well. In terms of safety and this kind of thing. But when we start to overthink, that's when it will cause us to not function well. So worry, it helps when it makes you make a better decision, or it helps you in terms of problem solving skills.
Thanks a lot for sharing that, Farah. So I think stress, I kind of understand that because it's time bounded in a way, because it's due to an external thing, right? Like it may have a natural end to it once I think the example that you gave, going up on stage to give a speech or something, right? Like once that ends, it would usually go away, right? I mean, I guess when it doesn't, that's when you need to maybe talk to someone about it. But anxiety, at least from what I understand from the two of you, it's a slightly different animal altogether, because a lot of it kind of just lies in your mind and it's kind of your perception of things. So maybe Sean, do you have any tips around how best can someone break a vicious cycle of maybe excessive worrying?
So let's use the example that you mentioned just now that Farah used. Stage fright, okay? So you go on stage and then you experience anxiety, and then let's say, okay, the worst happened. So you really did a bad job on stage, right? But after it has passed, it has passed. Technically speaking, after some time, you should feel better regardless of the outcome. But because of the bad experience, you now ruminate about it. You keep thinking about it. You keep analyzing it. You keep blaming yourself for not performing well. And then that kind of repeated thinking is preventing you from going on to the stage in the future. So as you can see, how stress, if we don't process it properly, can eventually lead to anxiety as well. Now, so the future has yet to come. You cannot be entirely sure whether you will be able to do well the next time if you go on stage. But because of your anxiety, you prevent yourself from going. So there's a vicious cycle here where you had initial stressful reactions, and then because of the stress, because of the unpleasant feelings, and you don't process it well, it is now preventing you from challenging your limitations in the future. And because you don't allow yourself the chance to go on stage again, to confront your stress again, to confront your anxiety again, you will remain there. And the longer you remain, the stronger the anxiety will grow. So to break the vicious cycle, we really have to step by step challenge our fear. So let's say you may not have the courage to go on stage straight away, but you can try to find another context to talk about the same topic to a smaller group. Okay, maybe just to your family members first as a practice. And then once you feel that, okay, I think I can do this, you talk to a larger group. Okay, and eventually the goal is to be able to step on the stage again. If you are anxious about swimming, if you have a fear of water, then you may want to go to the kids' pool to allow yourself to wet until maybe below your knee or something, and slowly, gradually, over time, you want to raise it above your waist, and eventually you want to be able to swim. So that's the idea. The way to break this vicious cycle is to slowly allow yourself to challenge your fear.
So I think what I'm hearing is kind of trying to normalize it so that you are then also able to rationalize whether or not it is something that is indeed kind of worth being that anxious about. Thank you for that, Sean. So I think that's kind of making me now realize again that we have now talked about stress and anxiety from more from a kind of emotional state perspective. But what about then the clinical aspect of it, right? So I don't know, and please feel free to correct me if I'm wrong here, but I haven't heard of a clinical diagnosis for stress, but I've definitely heard of a clinical diagnosis for anxiety. And maybe, Farah, you can share a little bit more about when does it become something that goes beyond just helping you cope and manage your anxious emotional state to then when you make a call as a professional that maybe this is someone who needs to be diagnosed with an anxiety disorder, for example?
So to diagnose someone with a certain disorder, as clinical psychologists, we refer to our DSM-5, Diagnostic Statistical of Mental Health. So there are certain criteria for us to diagnose someone with either generalized anxiety disorder or social anxiety disorder, and could be selective mutism is also part of anxiety disorder as well. There are certain criteria like the durations, how long has it been, and does it fit, like out of all, for example, there's going to be 10 criteria. So does it fit at least 6 of the criteria? And then one important thing as well is to see whether these symptoms, it affects their daily functioning. If it starts to affect their daily functioning, they're not taking good care of themselves, it affects their work, their social functioning. So that's when we know, okay, this person needs professional help. And if it fits with the criteria from DSM-5, then we can actually diagnose the person with that disorder.
Got it. So then, Sean, from your experience as well, I think, especially in a hospital setting, then once someone does get diagnosed with, say, generalized anxiety disorder or social anxiety, how then do you as a psychologist work with other healthcare professionals to then provide, I guess, holistic treatment, if that is a thing, to someone who may have been diagnosed with a psychological condition or a mental health condition?
Now, in a hospital setting, of course, we have to be aware that in a hospital, there will be limitations of a hospital system. So usually we work together and we would really like to work as closely as possible. But because of the nature of hospital, it's often not possible. So generally, what we do in a hospital setting is that the psychiatrist would decide on the medication part. So they will deal with the medication if they think that medication is needed, which oftentimes patients can benefit from them. And they would refer the same patient to a psychologist, and then the psychologist will see this patient separately, being informed about the psychiatrist's treatment plan. And then the psychologist would deal with the cognitive, the thinking and emotional aspect of it. So for example, if I see that the diagnosis given by the psychiatrist is social anxiety, I know that this person has got some issues with interacting with other people and social evaluation. So the diagnosis given by the psychiatrist is like a language to me. I see this term, I know what the psychiatrist has noted in this particular patient. So for example, if the psychiatrist says that this patient has generalized anxiety, I know that this patient is generally worried about everything, not only just about interaction or being evaluated by others. So although we really would like to have a multidisciplinary kind of collaboration where the psychiatrist and the psychologist are sitting together in one room together with the patient, that is pretty much the preferred way of practicing. In a hospital setting, it is quite rare, but we do that as much as possible. Maybe in one of the sessions along the way, we will sit down together and have a full team kind of session with the patient. But most of the time, different clinicians will see the client differently, the patient differently, and then we will have a separate meeting after the clinic day ends.
And what about then, I guess, Sean, outside the hospital setting, right? So I guess some people also go to individual, and I think we thankfully have more and more in Malaysia, like individual psychology centers. Then how does a patient go about coordinating kind of the need to see a psychologist versus a psychiatrist in that situation?
If the patient is referred to a psychologist by a psychiatrist, usually the psychiatrist and the psychologist would have some form of working relationship and they can communicate with each other. If not, most of the time, patients will really have a fragmented kind of care experience where they go to this doctor just for this issue, I go to the psychiatrist just to take my medication, and then I go to a psychologist separately and deal with separate issues, and the psychiatrist and the psychologist don't really talk to each other. And I suspect that this is the case for majority of the situations.
Got it. And I think maybe a question that would be relevant to both of you, right? Like in all of your experience in, kind of seeing someone who have exhibit kind of signs of stress and anxiety, and then for some who you feel has ticks the list on DSM, and then therefore you diagnose them with an anxiety disorder. How common it is for people to actually accept that diagnosis and actively do something about it? Maybe let's start with you, Farah.
I think when it comes to diagnosis, usually I will explore what would diagnosis mean to this person. Because for me, I know diagnosis for me as a clinician, it helps me to plan for my intervention, my treatment plan for this person, right? The way I work is diagnosis, I will provide diagnosis to this client, telling that person, your diagnosis is this, if it can give them clarity why they're feeling that. Yeah, but I will also clarify diagnosis is just diagnosis. What matters is the intervention part. How much you want to get better, knowing that you have the symptoms. Another thing is when it comes to diagnosing is also it helps as well for me to refer this client. For example, if I feel that psychiatric evaluation is needed, like medication is needed, it helps me to tell the psychiatrist, hey, this is my diagnosis for this client. Please go through, like do an evaluation again to see which medication would fit for this person.
And Sean, in your experience, like how open have people been about either following your diagnosis or following your treatment or intervention plan?
My personal belief with regards to openness to mental health services and diagnosis is this. People who truly need it will not appear in your clinic because they have put themselves in a situation where they will not listen to you, they are not open to it, and they will keep everything to themselves until they break. Most of the time, people who eventually end up in our clinic are people who already at least are open to it. So it is the degree of acceptance, not about whether they accept or not. So because people who truly don't accept, they never appear.
That's a interesting perspective and also quite a sad one, because I was just thinking at the back of my mind that we are now talking about people who show up at your clinic, right? And I think that already speaks volume in terms of like their overall readiness and, you know, I think as what you said, Sean, degree of acceptance. But then there's also in my mind now two separate groups, right? One, people who are, I don't know, so caught up in the stress and anxiety that they don't realize they need to get help. And then, of course, then there is now, Sean, you've mentioned this other group who needs it, but then they are just not at a place where they want to get it. So what are some of the reasons, maybe I think to you, Sean, first, on why do you think those two populations exist? Like, is there maybe, I don't know, stigma attached to it?
Well, this question is as deep-rooted as any issues related to belief. Why do people believe in certain things and not others? Why do people hold contradictory beliefs at the same time? So it's actually a question that has no answer. Some people simply just don't believe in it. In order for them to change, they will have to change belief, but changing belief itself means that it will require the person to change who the person is fundamentally, and some people are just not willing to do it. So there's really no answer to it. It's really a belief kind of thing, because even up till today, there are people who do not believe in depression. They don't think depression is something real. They think that depression is only a form of sign of weakness. You're trying to manipulate other people. They think that you're trying to fake MC and fake for medical certificate and so on. So this is really a belief thing. If you don't believe something is helpful or you don't believe something exists, there's really no way out.
So on that, Farah, maybe, you know, I think then this actually goes, you know, as Sean mentioned, it's core to like your belief system, right? So it's not just my belief about stress and anxiety, it's just maybe my belief about mental health in general. So what are some of the things that we can do actually to maybe raise awareness that I guess it's okay not to be okay, right? It's like, it's okay to speak to someone. Like, what are maybe in your mind some of the things that as a public or employers or friends and family can do to support this?
I think when it comes to awareness, the word will be mental health literacy. I make the conversation about mental health as something, a normal conversation. It's not something taboo. It's not something that is so weird. But again, to highlight, following out what Sean said, sometimes people, they find it hard to accept or to change their belief because there are risks at hand. What exactly is the risk if they say, believe in mental health? I believe people do have depression because of a physiological issue and this kind of thing. But what are the risks at hand if they disclose, I have mental health problems, or someone they knew have mental health problems? Because stigma is really a big thing. And to break the stigma, I truly believe that education is very, very important when it comes to this. Because without knowledge, without education, then you will still go on with whatever that you have, like whatever that you believe in. So, yeah.
Okay, I think we are kind of almost up on the hour, but there was just one last question that I have been dying to ask, especially after Sean talked about, you know, sharing personal vulnerability. So I've learned a lot from the both of you today. Thank you very much for that. But if you guys are okay, I would love to hear from each of you, maybe starting with Sean, on whether or not you could share any personal vulnerabilities on your front when, despite being a clinical psychologist, despite knowing all the facts, where you felt that you could not deal with the stress and anxieties in your life well, and what did you do to then overcome that?
Well, probably the most recent one would be my father's passing. So my dad passed away about 8-9 weeks ago, and it was because of suicide. So basically, he committed suicide 8 weeks ago because he couldn't cope with the stress, the anxiety of COVID. So he had diabetes for 30 years, and then he knew that he was in the high risk group. And then seeing the cases going up on a daily basis, seeing that people are suffering, he told himself that there is really no point for me to stay anymore, because even if I stayed on, it is only a matter of time that I get infected. And if I die of COVID, I will die a terrible death. So being a psychologist, I've worked with patients who has got who is a victim of suicide, basically. So they have a family member who has committed suicide, but experiencing it firsthand is different. So this is something that I'm still learning to cope, that I'm still working on. But I am really, really grateful to have people around me to support me through this experience. So even when I know logically and technically what to do to help myself deal with this pain that I'm going through, and probably the people who are supporting me, they are saying things that I already know. They are doing things that I would do to other people, but having someone to be there for me is just different.
Much for sharing that, Sean, and my most sincere and deepest condolences. Thank you again, Sean. I have no words. Thank you for your bravery in sharing that story. Maybe for you, Farah, kind of, same question, right? And I think around, sharing personal vulnerabilities. Have you found yourself in situations where, despite knowing all the facts, you could not cope with it well, and how did you overcome it?
Yeah. So I think the most that I can think of right now is the moment that I knew my parents are getting divorced. So it was a hard time for me because I was still learning, I was still a student then. I was in my uni, starting to get to know life, but then knowing that my support is actually separating, it was a big thing for me. So I make my way to another country, just calling myself to cope, but it's actually just me running away from the situation. What really helped me then was the realization that I am aware of what is it that I'm going through, like the process, the feelings I'm going through. Losing someone or losing a support system is a big thing, and it's a normal reaction. So I talk to people. I get myself into doing activities that brings value to me, and it really helped me a lot to recover in a way. But of course, because it's like a big thing that happened, right? Sometimes they do get to you. Whenever I see people with their parents and those kind of thing, of course it do get to you, but acknowledging it that, oh, it's their life, my life is like this. And I guess it really helps me as well. It drives me in terms of the work that I'm doing, the people that I'm seeing. It develops empathy within me. You just see people with empathy, like being good and showing kindness to people and showing compassion.
Thank you both. I am going to be very honest. I did not expect such deep and personal stories. I really appreciate it, and this is a good reminder why I am not a clinical psychologist, because I feel extremely moved by it. But I guess if I were to just summarize, I think, in kind of the ways that you guys have personally coped with moments of, times in your life when you are experiencing very, very high levels of stress and anxiety is, one, to not forget that you have a support system and to leverage and to hold on to that. I think too, from kind of your perspective, Farah, it's also to channel that stress and anxiety outwardly to then kind of be shown in ways of having empathy for others, right? So that negativity then translates into something positive that then ripples through. So I think thank you both again so very, very much. If I don't know if you guys have any last thoughts for our audience here today, right? Of course, to address the elephant in the room, all of us are on this little rectangular screens because I would have loved to have done this in person with you guys, but because of MCO, because of COVID-19, we are all stuck at home trying new ways of connecting with others. So then that elephant in the room is that we are still going through unprecedented times, which is highly stressful, right? It creates a lot of anxiety because I don't even know if MCO will be called off next week. So what is one advice that you could give to our audience in coping with COVID-19?
To me, reaching out for help is the only way. Even in the past, where we could interact with each other in person, we can talk to each other directly. If you intentionally hide your pain, no one can tell. Let alone we are in a situation where we don't get to spend time with other people. Other people are not able to be there for us all the time. The only way for us to really be able to probably go on is to know ourselves enough and to have the courage to seek help.
Thanks, Sean. And for you, Farah, what would be the one advice that you want to leave with our audience today?
I'll just keep it short. Just know that you are allowed to be vulnerable and you can talk to people about it.
Okay, with that, thank you all so very much for talking to me. I think this has definitely helped me feel less alone in some of the stress and anxieties that I have been going through. Thank you both again very much for your time today. Bye-bye.